I'm JoAnn Grafton, and I'm a digital composite artist. I was seeing a dentist who did a bridge down here and an upper denture, and he said I wasn't a good candidate for implants. I have an art show coming up, and that upper denture broke. Started desperately going to all the dentists in Rincon to try to find somebody that could help me. The last one I went to said, go try iHeart Dental. She loves dentures. And so that's where I went. So I went up to the receptionist desk and told her what I had going on, and she went and talked to Dr. Seal. Dr. Seal herself come out and sat down in the lobby and talked with me about what was going on.
When Miss JoAnn first came into the office, she actually was distraught. She was crying. She was upset. Went up to her and said, what's going on? Why are you crying? She broke her upper partial denture. And that is huge because that covered up most of her mouth. Of course, when it broke, there goes her mouth, there goes her smile. And so she was in a dilemma. She had dysfunction to go to. Her prosthesis broke. Now she can't eat. She can't speak. She can't talk.
First of all, I was impressed and almost brought me to tears that she herself come out to talk to me. I thought that was awesome. And then when she told me there was really nothing she could do about the dentures that I brought because it was a through and through break, my heart kind of fell. And then I asked her about helping me with the others, and she was able to do that. And she was just there with me the entire time and helped me get through it.
We were there to help her and go through the ways. But that was just a limited type of thing, emergency type of procedure where we come in, we fix that one problem. But it was more of a patchwork. We just got what needed to be done so we can get her on her way. I did recommend for her to come back another time and let's do a full exam and see what are your options and what other things can we do besides trying to repair a partial denture that is basically not going to last, forever.
So I went back later and we were looking at what was going on, and I asked her if I would be a good candidate for implants, and she said yes. So that process started.
She wasn't really happy with a possibility of going into a full traditional denture, and sometimes those dentures are not as secure, and with dentures, they're removable. They come in and out. So we thought of something a little bit more permanent, and so we came up with a possible all-on-X prosthesis. Now with all-on-X, they call it all-on-4, all-on-6, all-on-8. But we call it all-on-X here because X stands for any number of implants. So depending on their anatomy and the pre-diagnostics, we try to squeeze in as many implants as possible because the more implants that you have, the more structurally supporting the prosthesis will be. So before we get into any surgeries, we try in a series of monoblock dentures. Basically, it's all one color. It's not a traditional denture. The teeth are set to where it will replicate what her new smile could be before we go into surgery. And so once she tried in the different sets of teeth and she liked her smile, then we were ready to go on surgery. We went into surgery. Everything was very great, successful. She was amazing, a very great patient who was very compliant.
Now that first weekend, I got to tell you, I thought I'd lost my mind. You did this to yourself. Have you lost your mind? But even over the weekend, the office stayed in touch with me and checked on me and called out things for me that I might need and got me through that.
So the beauty of having things done at iHeart Dental is that the restorative dentist, the surgeon, the prosthodontist, everything is all in-house. We're all talking to one another too as well, and we're all communicating, and then we're all together when we go into surgery, which is great. It's beautiful.
So as I was almost ready to get my final permanence, I got T-boned and had a car wreck, and my head, the side of my face, hit the window really hard twice. It was like it hit and then a ricochet hit. So then we couldn't do anything with it for another 3 or 4 months because she wanted to make sure that no trauma set in and that I hadn't lost the implants that were in place.
Anything gets traumatized, it becomes inflamed. When it gets inflamed, the body wants to just reject it or heal it or whatever it does. So I wanted to make sure, hey, let's give it a little bit more time. We waited another 3 months and we put in our first set of what I call the temp try-ins. They're not the final. But we're able to take it apart now. We're able to mess with the implants because they're fully osseointegrated to the bone. And after we have that temp try-in, then I tell my labs, hey, finalize it.
When the permanents were put in and I did that first smile, I was just thrilled. I felt so confident just smiling and seeing that smile.
And that's what separates us too as well, because we want to make sure that the patient is really happy. They enjoy their new smile. It becomes one with them. They feel good about it. They can function on it. They can take beautiful pictures with it. All the above. It's a group collective effort to make sure that everybody's happy.
I smile more as I talk about it, and I probably make better eye contact with people, even though I was pretty good with that. And I've had, on 2 occasions since then, people tell me that I had great teeth. I mean, literally said, I love your teeth. They look great.
That's why I love doing what I do. And that's why I want to help people. That's why I became a dentist, to help people. And also make beautiful art and beautiful teeth. Teeth are very artistic, and I love it.
The whole team was so awesome. I just love everybody there. And I have been on occasion just to go by to say hey to everybody. But everybody took really good care of me, and any questions that I had. And like when the car wreck happened, I mean, everybody was just so attentive to me and concerned and helped me through the process. Anybody that was looking for this type of change, I would certainly encourage them to go see iHeart.
To say that patients feel that the team is great, it makes you feel good because we're doing something right. We're getting things done. We're spreading that positivity, and we're helping everyone as we go along.
I am JoAnn Grafton, and I love to smile with iHeart Dental.